Welcome to Medicare Made Easy, brought to you by USA Benefits Group and its affiliates USA Officials Exchange and Summit Benefits Alliance. Understanding Medicare and the options available to each of us as we turn 65 or qualify for Medicare through a disability can be confusing. Over the next few minutes, we hope to give you a clear understanding of what Medicare is and what it is not, how to sign up for it, and what else you may need to protect your financial and physical health at a price you can afford. The original Medicare consisted of just Parts A and B. To be eligible for Medicare, you must have reached the age of 65, be a U.S. citizen, and resident for at least 5 consecutive years. The law was also intended to help people with medical disabilities and provide coverage for them prior to the age of 65. If an individual has received Social Security disability for at least 2 years or has end-stage renal disease, they qualify for coverage under Medicare. Part A of Medicare provides coverage while you're hospitalized. Most people don't pay any monthly premium. Hospital stays are subject to a $1,216 deductible, and stays lasting more than 60 days require a copay of $152 a day. Multiple stays can mean multiple deductibles, and you have to be sure you're using a hospital that accepts Medicare. Starting to sound expensive, isn't it? Don't worry, we'll show you later how to cover all of these expenses with an inexpensive Medicare supplement plan. The good news is you can't be turned down due to medical history or a pre-existing condition. Part B covers doctors, outpatient procedures, lab services, medical equipment, and most everything else that doesn't require a hospital stay. Like Part A, Part B has some cost sharing. There's a $147 deductible, and then you're responsible for 20% of the approved Medicare cost. There is no limit to your maximum out-of-pocket expense, and you pay a monthly premium of approximately $115 a month as of 2015. Your premium can change based on your income. You cannot be denied coverage due to your medical history or a pre-existing condition, but you do need to be sure that the doctors you work with accept the Medicare assignments. For those who do not, you are responsible for all of the charges, so make sure you ask in advance. So although Medicare covers a lot, it's important to know what it doesn't cover. Parts A and B both have deductibles and coinsurance that you're responsible for. Part B has a monthly premium, and if a doctor charges more than the Medicare allowance for a particular procedure, you can be held responsible for the excess charges. Outpatient prescriptions will be covered under Medicare Part D, and if you want hearing, dental, or vision coverage, those are separate plans that you can purchase from your insurance broker. I'm going to skip over Part C for right now and look at Part D, since it's typically combined with Parts A and B to round out basic coverage. Part D provides help with the cost of prescription drugs. These plans are offered by private insurance companies and vary considerably in what they cover, meaning that all Part D plans are not created equal. With that in mind, if you will send your agent a list of your prescriptions, he or she will review all the Part D plans available in your zip code and make specific recommendations on which plans provide the most coverage for you for the least number of dollars. As agents, we don't make any commission on selling Part D plans, so this is purely a free service to our customers. You should be aware, though, that as with Parts A and B, if you do not sign up for Part D within certain time frames, you may be subject to penalties later on that will affect your premium costs for the rest of your life. We'll talk about the sign-up times in a moment. Now let's talk about how to cover all of those deductibles, copays, and coinsurance expenses. Medicare supplement plans are designed to cover the 20% that Medicare doesn't cover in Parts A and B. You have a wide range of choices of exactly how much of that expense your supplement covers. Plans A through G have higher premiums and cover more of the out-of-pocket expenses. Plans K through N have lower premiums, but you're responsible for more of those out-of-pocket costs. This chart shows what percentage of expenses not covered by standard Medicare that are covered by each of the supplement plans. As you can see, Plans F and G cover virtually all of the out-of-pocket expenses. Plan G does not cover the Medicare Part B deductible, which for the calendar year of 2015 was $147. So the most common configuration of Medicare coverage consists of Parts A, B, and D, along with a Medicare supplement plan. This approach can provide virtually 100% coverage for most medical expenses. An alternative to this approach is Medicare Part C, commonly known as Medicare Advantage. Medicare Advantage plans combine Parts A, B, and D. They are offered by private insurance companies, not the federal government, and often include eye, hearing, and wellness services. These plans are network specific, meaning that they are very much like the health plans for those under 65. Blue Cross has their network, United Healthcare has theirs, Humana has a different network. So doctors and hospitals may accept Medicare, but not be in your selected network. To qualify for an Advantage plan, you still have to be enrolled in Medicare Parts A and B. You still have to make the monthly premium payment for Part B, even though you're not using it. You have to live in the specific network service area and cannot have end-stage renal disease. Many Advantage plans have low monthly premiums, some even being zero. The thing that people need to be aware of with Advantage plans is that much like the under 65 plans, there are regular deductibles, copays, and coinsurance that you're responsible for. If you are on a Medicare Advantage plan, you do not qualify for a Medicare supplement plan. So in the event of a major health event or an accident, you could be responsible for a substantial amount of money in out-of-pocket expenses. To summarize the process, Step 1 is to sign up for Medicare Parts A and B. Step 2 is to pick between Option 1 and Option 2. Option 1 includes purchasing a Medicare Part D plan to help with the cost of prescriptions, and a Medicare supplement plan to cover the out-of-pocket expenses not covered by Parts A and B. Option 2 is a Medicare Advantage plan that combines Parts A, B, and D. The cost of Option 2 will typically be less than that of Option 1, but you will experience higher out-of-pocket costs for doctor's visits, testing, procedures, and hospital stays. Now that you have a basic understanding of Medicare, let's talk about the timing of all of this. The window to enroll in Parts A, B, C, and D is 3 months before and 3 months after your birth date month. Failure to enroll during this time period will typically result in penalties in the form of higher premiums for the rest of your life. For Medicare supplement plans, the window for enrollment in most states is 6 months prior to and 5 months following your birth date month. If a member is late in enrolling, it again typically results in higher premiums, and some plans are medically underwritten, which can result in denial of coverage. So the message here is to be sure and sign up during the appropriate times. Every year between October 15th and December 7th, you'll have an opportunity to change anything and everything about your Medicare coverage. All the changes go into effect January 1st of the following year. For Parts A and B, you sign up through Medicare.gov or your local Social Security office. For Parts C and D, you'll need to talk with your USABG insurance broker. Finally, here are some additional resources that provide excellent information on Medicare. For more information on plans that fit your specific needs, please contact one of the USABG agents listed here. To receive a printed copy of this presentation, click on the link below.